Hello, it's Thursday, November 5th, 2020. It's Dr. Rhonda Johnson. And today I'm going to be talking about protecting your eyes from being a source of coronavirus infection. But let me just take a minute and just remind us what we're dealing with here. Yesterday, the coronavirus found a new home, and 103,369 people, and sadly, 1,096 people lost their life due to this virus yesterday. Now, I'm going to use an analogy that I have used before. If 50 people fill an average size room comfortably, then yesterday we lost the equivalent of almost 22 rooms full of people just in one day from this virus. This is just so sad, and it will only continue. So moving from that reality, I want to, again, my only goal is to try to help save lives. And today I'm going to be talking about one more source of infection from this virus, and that is the eyes. Now, the first thing I want everyone to understand is that the coronavirus can be spread through the eyes just as it is through the mouth or the nose. When someone who has coronavirus coughs or talks, virus particles can spray from their mouth or nose into your face. You are likely to breathe these tiny little droplets through your mouth or your nose unless you have a mask on. But the droplets can also enter your body through your eyes. And people who have this coronavirus can also spread the disease through their tears, because the eyes are part of the mucous membranes in the body. So if you touch tears or the surface where tears have landed from somebody who has coronavirus, and then you touch your eyes or nose, that can be another way that people can become infected. You can also become infected by touching your eyes after touching something that has the virus on it. So you need to be thinking about protecting your eyes. Now, this coronavirus can cause pink eye infection. The medical name is conjunctivitis, but the ophthalmologists, the doctors who are experts in the care of the eyes, think that it is rare. So, a couple questions. Is it safe to wear contacts during this pandemic? The answer is yes. Be sure to wash your hands carefully and thoroughly with soap and water for at least 20 seconds before inserting your contact lenses or removing them. If water's not available, like everything else, use a hand sanitizer that contains at least 60% alcohol. Now, you may ask, should you be wearing goggles or a face shield? Well, the experts are sort of divided about this, but the best recommendation is if you work in a high-risk situation, you probably should wear protective eyewear. High-risk situations are doctors, dentists, nurses, hospital workers, but it can also include bus drivers or people who work jobs that you can be exposed to people coughing or sneezing in your face, especially if you're not behind one of those plexiglass shields. And also, if someone in your family has COVID, you should wear protective eyewear. And again, that can be inexpensive goggles, or it can be these face shields. A friend of mine bought me some face shields, and I was lucky. But basically, it has a band. You put it over your head, and it protects you. You still have to wear a mask when you are underneath the face shield. But again, the goal of the face shield is it protects your eyes from droplets from the virus. And they're cheap. And just remember to clean them with eye care solution, things that you wash your glasses with, or soap and water. And the other thing is, if you wear glasses, be sure to keep your glasses clean. Okay, that's it for today. This is Dr. Rhonda Johnson. My only intent is to help people stay alive during this pandemic. So stay safe, continue those 4 W's, and have a blessed day. My views are my own.